Medurstand-Understanding Medicine.
Professor Aziz Rehman from Medurstand, and now I'm going to demonstrate how to test the gait of the patient. Gait is one of the very important neurological sign, and you know it is not just the motor, it is not dependent on the motor system. It requires intact sensory system, intact cerebellar system, and in fact intact higher mental function to be able to walk properly. So one thing is, when patient moves to your room, you have some idea. If you're sitting in the office and patient moves to you and patient moves very normally, then you already know that the patient has got normal gait. But in neurological system, we will ask him to walk and see how he can walk. And this is, आप यहाँ से चल के ना आहिस्ता आहिस्ता इस लाइन के ऊपर से आप आहिस्ता आहिस्ता उस कैमरे की तरफ जाएं, फिर वापस आएं, राइट. सो ठीक है, तेज़ चलो, वापस आ जाओ, नहीं अपना टर्न करके वापस आ जाओ. Okay, so he was able to walk steadily without swaying in one direction or the other, and he was able to turn without losing balance, so he's got normal gait. There are various abnormalities of gait which could be important. You have spastic gait, which is seen in I think you can see videos on the internet. There is a spastic gait. You can see the patient is already paralyzed, maybe one side, and he has difficulty walking. Then is high stepping gait, which is seen in the sensory patient moves like this stamping. And then there could be drunken gait or cerebellar gait. There could be very important gait of Parkinson disease. Patient is bent forward and making small steps, and at the same time having tremor, and he tends to move fast as he moves toward you. So these are various types of gaits, and I think and then there's a waddling gait. Waddling gait is when your proximal muscles are weakened. Normally when I move like this, these muscles, the gluteal muscles, they support my hip and my weight. But in case of these muscles the weak, then I might sway like this, and this type of gait is waddling gait, and this waddling gait is a sign of the proximal muscle weakness. And another feature of proximal muscle is just to ask him to stand up from squatting position. या ज़मीन पे बैठेंगे ज़रा, उठ जाएंगे. All right, so he has no difficulty at all. This requires a lot of power, the proximal muscles, and if he is unable to do it, that is called Gower's sign, and that is a very typical feature of proximal muscle wasting. Of course, in neurology, I repeat again, you do not make a final diagnosis on just one sign. You have all the signs and then make a diagnosis, and ultimately supported by imaging like CT scan or MRI or other tests like nerve conduction study. Thank you.